Alrighty, so let's get started. Thanks everyone for joining us. It's been a pleasure to have you all join us. And if you have joined all of us through all of the sessions, this is our last session for our community of practice. So thank you so much for making it all the way to our final session today. Um, Today we will be focusing on sustainability, evaluation, and continuous improvement. This is again about tobacco use and cancer prevention for people with disabilities. And this session for today is presented by the National Center for Health and Public Housing and the Disability Network for Tobacco Control and Cancer Prevention. Just as a quick reminder that closed captioning is available to support accessibility during today's session. To turn it on, please navigate to your Zoom toolbar and click the Show Captions button indicated here as the letter A. Once the captions are enabled, you can also adjust your settings by selecting the drop-down menu labeled as B, where you can choose your preferred caption language, such as English, and access additional caption options. We highly encourage you to enable captions if it also enhances your learning experience during today's session. Here we have a few housekeeping items. Just as a reminder as well that our participants are muted upon entry. Please make sure you engage in the chat if you have any questions or just any promising practices or strategies or any concerns you would like to share with the audience and with the speakers. Please also raise your virtual hand if you would like your line to be unmuted. This meeting is being recorded and the slides and recording link will be sent to you all via email after the session. And as always, we always like to learn more about our audience. So please let us know in the chat your name, the organization that you're joining us from, the state, and also your title and what brings you here today. So now we're going to launch a brief 30-second pre-session evaluation poll. My colleague Paula Jamoke will be doing that right now. So if you can please provide your responses. So I'm going to allow just an additional few more seconds for the poll, just because we have some new participants that just joined right now. So if you can please provide your responses on the poll that you see on the screen. All right, awesome. Thank you. And this is now the end of the poll. So thanks everyone for providing your responses. So just a brief introduction about today's speakers or moderators. So with us in the line, we'll have Dr. Jose Leon. He's the Chief Medical Officer at the National Center for Health and Public Housing. And towards the end of the session, he will be co-facilitating a few case study session engagement questions. So we're looking forward to having him lead that across also with Chris. And also my name is Fida Pineda. I'm TTA manager here at NCHPH, and I am here with my colleague Jimoke, who is also helping facilitate today's session. And now we'll pass it on to Chris to get us started with today's presentation.
Okay, great. Thank you so much, Fide. My name is Chris Mackey. I am with the National Disability Network on smoking cessation and cancer prevention, and I'm also with the Lakeshore Foundation. We are a partner with the National Association of Chronic Disease Directors. on this effort and on our national network. We provide technical assistance along with NACDD on these issues of including people with disabilities into um, smoking cessation and cancer prevention programs and initiatives and health promotion initiatives in other areas as well. Next slide, please. Okay, so today I'm going to really take a look at inclusion of people with disabilities from the standpoint of sustainability, of course. You probably are notice, or you will probably notice if you've been on one of these sessions before, you'll hear some of the same information. Um, and again, it will be from the perspective of sustaining inclusion for people with disabilities in your program. I will encourage everyone at this point to take out your phones. We will provide, or I will provide through the presentation, a number of QR codes related that are targeted towards partners within the disability community that we have shared on a previous session. And but we'll also talk about them in terms of sustainability and continuing a focus on inclusion in your programming. So just encourage you to have those funds ready for in a few minutes when I talk about those organizations. Next, please. Okay, so again, if you've been on a previous session, you probably this probably looks a little familiar to you. These are the accessibility domains. That I wanted to talk about. And these are the 5 domains that you look at when you're trying to make your services more inclusive and welcoming to people with disabilities. These are the 5 areas that, and this is based on an evidence-informed framework. But these are the 5 areas that you look at when you're looking to make your program more inclusive of people with disabilities. So those 5 areas are the built environment, which is kind of the brick and mortar and the landscape where you hold your program. So that's the typical things that we think about when we're talking about accessibility inclusion. So the parking, the signage, the built environment, the bathrooms, and the doorways and that kind of thing. That's what the built environment refers to. Services are things like accessible transportation, providing alternate formats like a larger print version of your materials, and then something like sign language interpretation, which you're required to provide. Instruction can be anything that you, your staff, or your participants and their families learn. So it could be any skills that anything you learn to improve your skills or how you present your information and your instruction, um, your um, your counseling services, for example, to someone with a disability. You may need to think about doing that in a different way. Equipment and technology, that's kind of an obvious one, but it includes any products or tools that increase participation. And that includes anything from your websites, assistive listening devices, for example, and things like accessible apps for, if depending on how you run your program. The policy a domain includes laws, regulations, and other rules that guide behavior. So this is anything from something formal like the Americans with Disabilities Act or Section 504 or 508 of the Rehab Act, which we talked about in a previous session, and then anything that you have within your own organization that guides um, how you behave and does that how you conduct your services and does that direct you towards providing services more inclusively of people with disabilities. And I'll talk a little bit more about some examples of that in terms of sustainability in just a minute. Okay, so this is probably something I'm preaching to the choir here, but what are we talking about when we say sustainability? This is from CDC's Sustainability Planning Guide. It's the ongoing capacity and resolve to work together to establish, advance, and maintain effective strategies that continuously improve health and quality of life for all. And when we say all, of course, we're meaning people with disabilities included. So again, just to give a sense of what exactly we're talking about here. Next slide, please. Partnership is paramount. If you do nothing else after this webinar, please, please, please find a disability organization or individuals that you can partner with to help you make your services more inclusive with people with disabilities. Regardless of what it is you're working on, having that direct input from people with disabilities themselves and disability organizations, and as I've said in a previous session, people with disability expertise. So, occupational and physical therapists who are adept at providing adaptation on a regular basis. They can help you as well. That's just an example. And then, of course, and I'll talk about this towards the end, we have resources within the National Disability Network that you can tap into, and organizations that you can tap into. So I really, really, really want to strongly emphasize partnership as part of um, adapting and making your program more inclusive, but also sustaining it. Next slide, please. As with anything related to inclusion, it's very important to start early, start as soon as you can, and establish your partners. As I said, that should be one of your, if not your first step. Um, so how do you do that? What are some strategies? Attending conferences and presentations and going to health fairs of disability organizations, or inviting a disability organization to attend an event that you might have. Um, Looking for organizations with the reach that you need. And I'll talk about Centers for Independent Living, state disability, developmental disabilities councils, and assistive technology programs. All three of these organizations are in every state, and they have statewide reach. Um, and so these will be the organizations that you can tap into that know where people with disabilities are. And also, as I'll talk about in a moment, they can help you with other aspects of making your programming more inclusive of people with disabilities. Always, if you have an opportunity to seek some funding that benefits, a disability organization's maybe health program, as well as the services that you have. If it's something you can work on, definitely seek that out. And then always, again, as I said, seek input from people with disabilities. So you can provide surveys, you can do focus groups that target people with disabilities and disability organizations to ask them about what individuals or the people that they serve face when it comes to trying to quit smoking and trying to access care in general. All of those, both of those sort of situations pose barriers to people with disabilities regularly. So it's important to really gather that input. And one way you can do that is to just work through disability organizations and target people with disabilities directly. Next slide, please. Okay, so here's the opportunity. Please, if you want to, please get your phones out. And in terms of sustainability, these are two really important organizations. And again, I've shared these in a previous session. Centers for Independent Living um, are really they're organizations that are and created for people with disabilities, and they're run by people with disabilities, or at least a certain percentage, 51% of their staff has to be people with disabilities. And um, they have connection to almost anything. One of the most important functions they have is resource and referral of people with disabilities to different resources that they might need. And so developing a partnership with your centers for independent living can be very beneficial. Some of the things they could help you with, again, is connecting you to where people with disabilities are, developing partnerships. They can help you with um, uh, training on issues such as disability awareness. They can help you with, and they have responsibility to actually conduct um, accessibility reviews and and just helping you understand how your program is structured and where their barriers might be. And again, these are this is an organization that is made up mostly of people with disabilities, and so they have a lot of experience um, with the disability community in your state and again, understanding how to make an environment more inclusive of people with disabilities. State AT programs are a great partner. They often provide, or they do provide, uh, access to assistive technology and could be a good partner and a location to have access to different pieces of assistive technology that assist someone with a disability in quitting smoking. And so, or they might be able to provide you with different devices like an assistive listening device to help someone understand or better participate in a counseling session. Those are just two examples. So, state AT programs are really, really important, and again, a good organization to get to know. And then these are just, not just, but these are three other disability organizations that I previously shared. Again, feel free to copy down the QR codes. Um, Easter Seals is well, it's a cross-disability organization, but they really focus strongly on supporting people with intellectual and developmental disabilities. The ARC is another organization that specifically targets and supports people with intellectual and developmental disabilities. And then you all probably have heard of the Special Olympics. Um, the first two organizations are good to have a connection with, again, because they have connection to people with disabilities. They can help you understand how to create and make parts of your program accessible and more inclusive to people with disabilities, and particularly people with intellectual disabilities. And then the Special Olympics can do the same thing as well. And they have great resources, but they're also another organization, as you probably know, that focuses on sports and recreation. And when you're talking about assisting someone who has a disability and is trying to quit smoking, that's a good organization to um, orient someone towards or bring someone towards to help them uh, find something to um, replace that, to engage in a healthier behavior. And so Special Olympics is a great partner to develop. The sort of presence of Special Olympics does vary from state to state, but you can go to the national website, specialolympics.org, and find your local chapter and your state chapters. Next, please. So with probably one of the most chief concern, one of the biggest concerns that organizations have when we start talking about creating more inclusive services is the cost. And what we do encourage you to do as part of, and I'll talk about this in a minute, part of your action plan is think about budgeting. Yes, there are grants out there, and yes, um, um, there are organizations that you can receive funding from that can help you can help you improve your services. But those opportunities are often few and far between. And no matter what, if someone with a disability comes and asks to take part in your services, you are responsible for at least doing your due diligence and making an effort to provide the same services to them as you would to anybody else, and engaging in all of those, engaging in adapting what you're doing. Um, but some of the things that you would think about budgeting would be things like assistive technology devices, again, partnering with that AT program in your state. So you look for things like assistive listening devices. In a previous session, we talked about different accessible apps for someone with vision loss, for example, who has trouble reading any kind of material or reading labels on medications or things like that. Um, Diagnostic equipment, I don't know how much that applies to the services that you all provide, but things like budgeting for a wheelchair accessible scale could be something. Um, Making sure that you have a line item in your budget for sign language interpretation and you have that partner against, somebody like a school for the deaf, or a state services for the deaf agency where you can find those services, where you can find a sign language interpreter, making sure you have that budget item, um, or that is something you could budget for, excuse me. Uh, Other things would be creating alternate formats such as large print or braille. Um, and of course, that applies to your educational and counseling materials. And when you are working with partners, they can help you decide what you should prioritize. And it depending on what you do, everyone's different. But with creating alternate formats, you could partner with um, a Center for Independent Living. Sometimes they have uh, the ability to create uh, Braille versions, or maybe a school for the blind. So again, thinking about that partnership piece is really important. Website and or app accessibility updates. This, particularly when you're talking about accessible websites, that can be a really involved and long-term um, process. And so you want to make sure that you really examine thoroughly what your website, how accessible your website is, have people with disabilities try it out, and then you can create in your plan of action. Again, I'll talk about that. In your plan of action, you can create a um, a timeline for yourself, and it's usually going to be a little bit longer for websites. And then needed renovations. Many buildings, if not most, are already at least basically accessible. But again, conducting that accessibility review with a disability partner is going to be really, really important to understand how much of your facility is accessible, is if that's where your programming is located. Next slide, please. Okay, so these are just a few assessment tools to help you know how accessible and inclusive your programming is. It doesn't necessarily focus on smoking cessation. I'm not sure those kind of assessments actually exist yet, but we are looking at how to do that within our national network. But there are a few here that I might recommend to you. The first one is the National Center on Health, Physical Activity, and Disability, or NCPAD, their Community Health Inclusion Index Assessment tool. And there are two particular versions of it that I would direct you towards, and you'll get the links and the slides after the session today with so you'll be able to access them. The organizational assessment probably is not as applicable to you, but I did want to include it. It does have basically the issues that you should be addressing. Most of what you'll see in that, though, is and both of these assessments were directed towards physical activity and nutrition programming and how to make them inclusive. But you'll notice in the organizational assessment, some of the issues that you want to address, like staff training, and how to do that, and it can apply it to your organization. The on-site assessment is probably a little bit more applicable, and it certainly is what you typically think of when you are talking about inclusion. But the on-site assessment is a little bit different because it does have a section towards the end that focuses on, first of all, healthcare facilities and healthcare accessibility, but also infrastructure. So, how do you understand, or how do you know if your sidewalks are accessible and the bus stops around your practices are accessible, and your counseling centers are accessible? So that's a good one to get to know, especially those two pieces of it. Um, Special Olympics has the provider self audit tool, which is a great tool that they use, obviously, to understand how accessible and inclusive healthcare facilities and healthcare practices are towards people with disabilities. Um, The unique feature here with this one is that it gives you a sense of how difficult it is to address the barriers that you identify. Um, and it is a Special Olympics, so it is really mainly focused on individuals with intellectual and developmental disabilities. But a great tool to have. That's part of their inclusive health, National Inclusive Health Center at Special Olympics. And then there are a number of checklists out there that are just sort of, again, the basic brick and mortar accessibility checklist. One is the Americans with Disabilities Act checklist for existing facilities. That's adachecklist.org. And again, it really talks about the fundamental elements of what makes a building accessible. So how does your parking look? How does your interior space look, your entrances, your paths of travel, your restrooms? It's that kind of basic level building accessibility. Great tool to use. It does get very, very detailed. Because that's honestly where access and inclusion happens is in the details, but it does get down to the measuring of things in inches, and getting towards what the ADA standards for accessible design actually require. So it can be useful if you're looking at your built environment, but again, keep that in mind. Uh, excuse me, when you're trying to use it. Next slide, please. So another strategy to sustain any focus on inclusion is to build your skills around inclusion. Um, and in partnership again with disability organizations, um, they can actually help you identify topics that you need to address. And those can be anything from, as I said before, accessibility reviews or checks. Again, Centers for Independent Living are great for that. Disability awareness training. Almost any disability organization is has some skill in just disability awareness, how to interact with people with disabilities, attitudes towards people with disabilities, and how to sort of address that stigma, that kind of thing. Almost any disability organization is good at teaching that. Um, Even small things like being a sighted guide for someone who's blind, and organizations that support people with blindness and vision loss can help you with that. But Centers for Independent Living or a another cross disability organization could help you do that as well. Learning some American Sign Language words or phrases, just some basics. Oftentimes, I know in Alabama, our Institute for the Deaf and Blind has offers organizations opportunities to learn some basic, very basic sign language words and phrases that would be useful to them, and they do it for free. So that could be something you could look into as well. And then just making sure that you stay updated on the requirements for the Americans with Disabilities Act and other disability rights laws. And I would say in that case, more specifically, focus on inclusive and or more accessible information technology. So that's kind of the up and coming major area of concern for people with disabilities, and so making sure that you're up to making sure that you know the standards and the design requirements, or that your IT folks know where to get that information related to websites. Um, is a great skill to build. Obviously, that would apply mostly to your IT departments. Next slide, please. And then thinking about your communication. not only in how you communicate with participants, but how do you communicate with your community? How do you communicate in a way that makes or encourages people with disabilities to seek out your services and your assistance and the programming that you provide? But this includes things like paying attention to and updating any imagery to ensure that it's inclusive of people with disabilities. So really what we're talking about is actually having real people with disabilities as part of your campaigns and your public facing materials. The national network, the National Disability Network, is creating in the process of creating a TIPS adjacent campaign is what we're calling it. It's a disability focused campaign that is sort of mirroring the Tips from Former Smokers campaign that the CDC has developed. And the difference is that this is targeting people with disabilities, whereas you'll see people with disabilities in the original tips for former smokers campaign, but they develop their disabilities because of smoking. We are targeting people who already have disabilities and encouraging them to quit tobacco through this campaign. So that should be you'll probably start seeing that from the Disability Network within the next month or so. Um, and then, as I mentioned before, um, having your information communication technology uh, um, be accessible is very, very important and increasingly more important these days as programming and use of the internet and use of online services becomes more prolific. I've mentioned a couple of resources in previous sessions. WebAIM or Web Accessibility in Mind is at Utah State University. Uh, they have a expansive website on exclusively making information technology more accessible to people with disabilities. Again, federally funded agencies follow the rules set forth in Section 508 of the Rehabilitation Act, and that's covered at section 508.org or .gov, excuse me. And what I would say too about WebAIM is they have a what's called a WAVE tool, and it's a web accessibility evaluation tool. And what that is, it's a free online tool that you can use to evaluate how accessible. It's really kind of one web page at a time, but it is a gives you a starting point for evaluating your accessibility, the accessibility of your website. And then thinking about your social media is also important and making sure that it's appropriate or that it's accessible through things like appropriate hashtags and um, um, you know capitalizing each individual word, for example, is a more accessible hashtag than having everything all one word and all lowercase. And then also specifically through your social media, targeting people with disabilities, again, as you would with your campaigns, um, and making sure that information that you are trying to put out via social media is targeting disability organizations that you might partner with or other people with disabilities that may need your services. Next slide, please. So you can also, um, within your organization and your program, focus on program policy system and environmental change. If you're in public health, you probably have heard PSE change, policy system and environmental change. As you can probably guess, as we've been talking about, we also focus on program accessibility because you can have policy system and environmental changes that increase access to the program. But if your program itself doesn't work for someone with a disability, you need to change that as well. So we say PPSE rather than just PSE. But within your organization, including people with disabilities, on your on your governing boards or your advisory boards, putting people with disabilities in decision-making positions for to help bring that lived experience to your organization and how you create your services. Evaluating your policies to ensure continual focus on accessibility. Something as basic as, do you see the words people with disabilities in your policies somewhere? About, somewhere where you're talking about your services, do you see the words people with disabilities? Make it very explicit. Creating policies focused on cost considerations. I talked about budgeting, things you can budget for. Do you have a policy, written policy that is known to your organization that has that basically that says that you have a line item that focuses on providing inclusive services to people with disabilities? And then of course, as we talked about, identifying partners that support inclusion and create procedures to obtain those services. So if you know you need, if you have a partner who provides um, sign language interpretation and you know you need that, create a policy around how to obtain that service so that everybody knows if someone who's deaf and needs American Sign Language comes into your program and they need sign language interpretation, they know exactly who to call, exactly um, who to turn to, who to the organization to partner with. So these are just some examples. What I would also say is you can actually next slide, please. Sorry. Okay. Um, yeah. So these are some examples of policies, and it's kind of repetitive of the last slide a bit. But again, making sure that your you have explicit focus in your policies on including people with disabilities, and that you have people with disabilities providing some direction to the services that you provide. Um, I will say too, another sort of example of a way that your organization can promote the health of people with disabilities and promote inclusive services is to participate in things like community health needs assessments or community health improvement plans. And those of you in public health, understand this quite a bit, but you can incorporate the needs of people with disabilities and be an advocate for people with disabilities in those plans. And that's just another way to sort of be an ally for people with disabilities. Next slide, please. Okay, so I hope in addition to finding a partner, developing a plan of action, and we're doing this with our national network over a more extended period of time, through the end of this fiscal year, with a few states and teams from states. But we want to make sure that you put something on paper about what you're going to do for people with disabilities, and to make your programming more inclusive. So this is just an example um, for uh, making cessation education materials more accessible for people with disabilities. So you've identified that as a barrier. You want to, obviously, you want to make to remove that barrier. We want to make those materials more available in Braille or large print. A partner would be to help you do that would be a Center for Independent Living and a School for the Blind, and then persons responsible, whoever that might be. Hopefully, it's someone who can make some decisions, but a clinical director, operations manager, educational services manager. I don't know what title you might want to include, but someone who can make the decision about providing uh, providing the services that you provide in a different way, and then set your own timeline, and then think about break down the action steps for that. What are those action steps? What they might be? And that can, always has to include meeting with partners, um, thinking about, or excuse me, allowing them to um, review your materials and give suggestions, and then making sure that whenever you make a change, that you notify your potential participants, you notify the public that these services are available to you. I think one of the biggest barriers that people with disabilities, or one of the reasons why people with disabilities don't go somewhere or use a particular service is they don't think it's accessible. So when you say we are accessible, that encourages people with disabilities to, and you identify what services you provide. That encourages people with disabilities um, to approach you and use the services that you do provide. Next slide, please. Okay, so this is the from the National Disability Network on Tobacco Cessation and Cancer Prevention. We have a resource library, and one of the topics that's covered in the resource library is disability integration. Um, and essentially, this is for you, and it's a curated collection of tools and resources focused on, among other areas. Um, including, among other areas, people with disabilities and how to include. So we have previous webinars that we've given. We have different tools. We have um, information from our national network. There is a newsletter that we do send out to individuals who are interested. So there's a lot of good information, good resources. There's information about different kinds of assistive technology or organizations that can provide uh, smoking cessation services to people who are blind, for example. We have a great partner named called Accessible Pharmacy. I mentioned them in a previous session. So great resource to look at from NACDD. Next slide, please. So Dr. Leon and I are going to facilitate a little discussion, a little bit of a quiz for everyone. And we want to encourage you to engage with us in the chat. And we're going to look at a specific person, and we're going to talk about sort of how do we include them in our smoking cessation cancer prevention program. So, Dr. Leon, do you want to start us off?
Sure. Thank you, Chris. And hello, everyone. Thank you so much for attending this activity. This case study is more oriented for community health centers, but we would like to hear from all of you. You have different perspectives, you have different experience, and I'm quite sure that everyone has the ability to provide and the skills to provide some feedback and just to make this activity interactive and making sure that we have somehow obtain all the knowledge that Chris has shared with us for the last 4 weeks. So this is our case study for today's presentation. We're talking about a patient, Darren, who is a 50-year-old single male that is unemployed with a moderate intellectual disability who lives with his 72-year-old mother in public housing. His mother serves as his primary caregiver and provides supervision and support with daily routines. Darren has smoked cigarettes since the age of 16. Over time, smoking has become a highly structured part of his day, and he now smokes approximately one cigarette every hour during waking hours. Because of concerns about fire safety in the home, his cigarette and lighter are kept in a locked drawer by his mother, who gives him a cigarette each hour upon request. This arrangement, while intended to reduce safety risks, has also reinforced Darren's long-standing smoking routine. For several years, Darren has experienced a persistent chronic cough. During an annual health visit 3 years ago, a nurse suggested that the smoking may be contributing to his respiratory symptoms. Darren perceived the conversation as criticism rather than support, became distressed, and has avoided returning to the clinic since that visit. As a result, he has not seen either his primary care provider or nursing staff for follow-up evaluation. Today, Darren and his mother are at your health center because his mother wants to help him to stop smoking. Next slide, please.
Yeah.
So we have some questions for you, and Chris, please help us with
Sure.
all this based on your knowledge and experience. But the first question that we have is, what are the main considerations for an interview in Darren's case? Is there additional information about Darren that you need to know? And in order to participate, please use the chat. You can type your response or um, use the hand raise icon, and your line
Yeah.
can be unmuted and you can participate verbally.
See if anybody's okay. Well, think about some basics. How would you provide information to Darren and his mother? What would be in your particular program? What would be a concern if he came in and you knew that he had an intellectual disability? What would be a concern about the information that you provide? Right. So one person says one consideration is how Darren best receives feedback and how and how he and his mother communicate. Yeah. So again, bringing in um, that communication issue. Does How does he receive feedback, but also how does he communicate primarily? What if the information that you have is all written, what do you have to do to change that? Another person says, including mom, but allowing time for Darren to speak as well. Hugely important. I think most of all too often, what you see in a variety of settings with practitioners is they talk to the parent, they talk to the relative, they talk to the person who can communicate, you know, and ignore the individual with the disability. Absolutely focus on and figure out a way. Is there a way that you can engage Darren and his mom? Don't let his mom do all the speaking. Another person says, what does Darren think? Yes, absolutely. I would want to know if Darren wants to quit smoking and what he thinks about pros and cons of quitting versus continuing smoking. So that's very good. Yeah, absolutely. You want to get his thoughts about smoking, and also that's another area where you think about, how am I asking him about his smoking? How am I asking him about what he thinks? How do I adapt that so he understands it a little better? And talk about, when you talk about pros and cons, are you giving concrete examples of how smoking makes you feel bad and how smoking makes you feel good, and how quitting smoking makes you feel good? Excuse me, very wrong thing to say. So thinking of that in very concrete way. What medications are Darren taking at the time? Sure. And adapt motivational interviewing. Yep, absolutely. That's kind of what we're talking about. Looking for that change talk, and just it's not about changing what motivational interviewing is, but changing how you're presenting the information, keeping it simple, keeping it one idea at a time. Let's see, who else? What else do we have here? That looks about it. Um, Also, and I think eventually down the line too, I think it's good to know what else, other things about Darren's life. So what else does he like to do? What are those alternatives that he likes to do that, you know, you- I'm making this up, but if he's, interested in getting a little more physical activity, kind of having that healthier habit instead of smoking, and then what is that organization out there that might be able to help him do that? Special Olympics, for example. So tying in that partnership is a good thing to think about. And then, okay, so how can you adapt your smoking cessation services so patients with disabilities feel supported rather than judged? And we want you to think about your own program, your own services. How do you, what are you doing now, and how are you planning to change your services uh, so that they're more inclusive of people with disabilities? And I want to invite anyone again to put that information in the chat, or if you want to raise your hand, and we'll take you off mute if anybody has any thoughts already. No, nobody's brave enough, it doesn't sound like yet. Yep,
We have one comment from Audrey.
please
She says, speak at their level, being
speak at their
realistic,
level.
friendly, and understanding.
Okay. Yep, sure. Yeah, absolutely. Um, and yeah, and again, that's about any kind of information that you're providing. Speak at their level. If there is information that you're wanting him to take with him, make sure it's at his level. Make sure it's something that it's presented in a way that he will be able to use when he gets home. Um, okay,
Chris,
let's
the other
see.
thing, and I remember you mentioning that if you have a group, you have to adapt your materials. If you have someone
Yep.
with a disability, I think that that's another great idea to include here.
Yes, absolutely. Yeah. And so thinking about alternate formats, thinking about reading level, thinking about easy read format, lots of pictures, a lot less text, and less sort of speaking, giving people examples, real life examples of the things that they need to do and can do to quit smoking. So why don't we go on to the next? So we're running up on the hour here. Next slide, please. And then how would you tailor a conversation? And we kind of answered this a little bit already, but how would you tailor a conversation on tobacco cessation with Darren? What kind of adaptation do you need for him? It's kind of getting a little more specific, but we've mentioned it a little bit already. Extra time, absolutely. Extra time to answer questions, extra time to grasp grasp concepts. Maybe your session with him is longer than what you usually provide. Other thoughts? Excuse me. No other thoughts? Okay. Oh, okay. Hands-on learning or video materials. Yeah, absolutely. And um, the more visuals, the more we have a curriculum that's for people with intellectual disabilities who are at high risk for diabetes. And every single session of that curriculum has a video with it. And it basically just reiterates what the session's about and what the previous session was about. So, um, reviewing, making sure that you have hands-on and real life materials. I'm going to keep going just so we don't run out of time. Do you see any ethical considerations for this case? Anyone? What I would suggest for this, and Dr. Leon, if you want to chime in, please do. But for this, one of the things we've been told by one of our disability partners is that smoking is, for many people with disabilities, that's the only thing that they get to choose in their daily life. And so taking that into consideration and keeping in mind that you may be taking away their only piece of autonomy if you ask them not to smoke. You need to kind of keep that in mind as well. We have a couple of comments, potential unsafe home environment if it gets a hold of a lighter, fire hazards. Yep, and that was mentioned in the original scenario. And then we wouldn't want to force Darren into cessation program just because his mother wants it. Yeah, absolutely. Maintaining that autonomy and remembering to do that with any person, but particularly for people with disabilities. So again, very important. And then who else in the community would you work with to help Darren? And this gets into the partnership aspect of it. What organizations could you tap into? And I mean, in your specific case, with your specific program, you could get peer support. Yep, it's possible. A lot of, particularly SILs too, they do have support groups that focus on health issues. I have seen that happen before. So there's healthy athletes within Special Olympics, which is a good place to kind of get some targeted support. I don't know how much they focus on tobacco cessation, but that could be another organization to look at. So again, we're coming up on time, so I want to be
I just want to mention something
please.
else, Chris, and is the fact that we work with health centers that are close to public housing developments. So any interaction with the public housing authorities is recommended so they can have, a protocol, a smoking cessation protocol with them or develops partnerships to help these patients and not only the general population, but their patients and specifically those who have a disability.
Yeah, absolutely. That's a great idea. Yeah, and you're both are kind of learning about what it means to be accommodating to people with disabilities. So that's an excellent idea. And then also, I'll just quickly mention, just think of who is Darren's support network. Is it just his mom? Who else? Are there teachers? Are there, I'm kind of making this up, but are there coaches and or siblings, other relatives that could support him in not smoking? Get them involved as well. And so again, another thing to think about. We're coming up on time, so I think I'll just maybe go to the next slide, which might be our I'll skip this. We kind of talked about that already, if that's okay with everyone, just so we don't run out of time. But again, be thinking about first things first. Who is your disability partner that you're going to select and work with to make your programs more inclusive? And then think about that plan of action. What's the accessibility issue you will be addressing? And consider maybe using one of the assessment tools that I mentioned before, and there are others out there. Again, nothing really specifically about smoking, but they can help you understand and decide on how to address accessibility and inclusion as long as you're working with a partner. Okay, next slide, please. I think that might be it. Yes, happy to take any questions, and I think we're right up on time.
And just while we wait, if we have any questions that pop up, I would like to remind everybody to please complete our post-evaluation survey. The link will be provided to you in the chat. So please let us know. And again, your assessment will be very useful for all of our future TA trainings.
And I don't see any other questions that have come up. But great suggestions. And again, I just want to encourage everyone to continually think about this. Continually think about who do you partner with in your community and what do you need to focus on. So good luck, and I hope at least some of this was helpful to everyone.
Thank you so much, Chris. Thank you, Dr. Leon. Thanks, Jumoke. And also thanks everyone for joining us throughout this series, Community of Practice. It's been a pleasure to have you all join us. And we'll be so glad to keep in contact with you about any future activities that we have coming up. And again, thank you so much, Chris, for all the wonderful information that you shared with us in all the sessions.
Thank you.
Well, have a great day, and we look forward to seeing you all soon. Have a great day.
Bye, everyone.